It's okay. Yes, please. So welcome everyone to the presentation on the position paper of the third International One Health Conference. We are here in Baku at COP29, a very important moment for all the world that is deciding about like climate change action. Here in these days there are the negotiations for climate, but it's important to address also another important topic. And we are here properly to do that with a vision, with a framework that is the framework of One Health. We are a little bit late, so I will not spend so much word. I will give the floor for the opening remarks to Cristina Romanelli, that is here with us from WHO. We are very glad and honored, Cristina, that you are here with us because it's important to connect WHO, to connect the universities, academics, and all the network that is dealing with One Health. So I give the floor to the opening remarks. Thank you very much for being with us.
Thank you so much. It is such a pleasure to be with you here today. I am always particularly excited when I'm talking about One Health. And I'm very happy to see that we're discussing One Health in several side events here in Baku at COP29. Just yesterday, actually, we had a high-level event on One Health where we have the four quadripartite agencies. It was led by the Azerbaijani presidency, and it was a terrific event because it really is about where we need to go. But for this event, I'm really glad that we're shining the spotlight on the Mediterranean, a region that really, I think, exemplifies the interwoven crises of climate change, biodiversity loss, pollution, and their profound impacts on human, animal, plant, and ecosystem health. I think that it's fair to say that the Mediterranean's vulnerability was really starkly highlighted just last month with devastating floods that struck Valencia in Spain and claimed over 220 lives, displacing thousands and destroying families and livelihoods, as many of these events do. And this tragedy is only one among so many sobering reminders of the accelerating impacts of climate change, compounded by biodiversity loss and environmental degradations. And I think that it's events like these that really underscore the urgency of addressing these challenges in a much more integrated and holistic manner. I also think that it's fair to say that the Mediterranean is one of the microcosms of the global climate biodiversity health nexus. And its terrestrial and aquatic ecosystems, very rich in biodiversity and cultural heritage, are increasingly under pressure from pollution, unsustainable resource use, rising temperatures, biodiversity loss, ecosystem degradation. And these pressures really affect all aspects of life in the region, from physical and mental health to cultural and dietary traditions that have sustained Mediterranean populations for centuries and, dare I say, millennia. As one of the many examples, one of the region's greatest assets, the Mediterranean diet, for instance, really is a model of biodiversity-based nutrition renowned for its health and sustainability benefits. And traditionally, plant-based, in particular, dietary patterns not only promote nutrition, but also support sustainable and healthy food systems. But we also know that the Mediterranean diet, amongst others, is under threat from changing agricultural conditions that are driven by climate change, driven by biodiversity loss, including through increased droughts, soil degradation, and the loss of ancient crop varieties and breeds. So preserving and adapting this dietary heritage is not just a cultural imperative, but also a strategy for fostering climate resilience and ensuring food security in the region. At the same time, and I'm drawing upon a lot of the thematic areas that you have in this terrific position paper, we see an increase in the mental health impacts of global environmental change and how these are becoming increasingly apparent as well. This phenomenon, known as eco-anxiety, is especially prevalent amongst the younger generations, and I think that COVID-19 was a perfect example of this. And it really reflects the profound psychological toll of witnessing climate change, of witnessing biodiversity loss and environmental degradation. I think that we can say that schools, universities, communities, and health systems can all really play a role by incorporating climate education, but also supporting youth-led environmental and health initiatives, and ensuring that we have access to mental health resources. Another one of the concurrent challenges, and I know I'm painting a really stark picture here, but I think we need to call a spade, and I think it's important to recognize the multifaceted challenges that we face. So plastic pollution, for instance, adds another layer to these challenges. And we know that plastics have infiltrated terrestrial and marine ecosystems, harming biodiversity, disrupting ecosystem services, and really threatening human health. Isn't it scary to think that on average, one person could be ingesting approximately 5 grams of plastic per week? And no child born today is free of microplastics to which embryos are exposed from their time in the womb. So plastics release toxic chemical additives into the environment, which cause cancer, endocrine disruption, cognitive impairment, and reproductive harm. And they also serve as vessels for pathogens, exacerbating the spread of diseases. And of course, vulnerable groups, including children, including women, including marginalized communities, indigenous communities, globally, really bear the brunt of these impacts and facing much higher risks of pollution-related illnesses and environmental injustices. So just to say that the WHO strongly supports a holistic approach to these interconnected crises, as is reflected by our longstanding support to countries in the implementation of the One Health approach. This One Health approach has been expanded in recent years, not only with by embracing the addition of the United Nations Environment Program in what was the tripartite alliance formed by WHO, the Food and Agriculture Organization, and the World Organization for Animal Health, but also by embracing the very first common definition of One Health that was put forth by the One Health high-level expert panel. And I think that by fostering collaboration across sectors, we can really address systemic challenges, such as zoonotic and vector-borne diseases, pollution, food and nutrition insecurity, and other health risks associated with ecosystem degradation, with climate change, much more holistically and much more effectively and coherently. Overall, let's think about this. 1 in every 4 premature deaths is attributable to preventable environmental factors, and no single sector can really address the associated health risks alone. on the issue of plastic pollution and how we can expand this definition and application. I think the WHA was a perfect example because WHO adopted a landmark resolution at the time on pollution, waste, and plastics, also calling for a One Health approach to pollution, which is not one of the traditional areas in which One Health has been applied. And I think that for the Mediterranean, where plastics pervade both terrestrial and aquatic environments, this resolution provides a critical mandate for action. And it also provides a critical mandate not only for countries of the Mediterranean or the WHO as a whole, to generate robust data on the health impacts of plastics, to close some of the knowledge gaps that remain and persist, and to drive real evidence-based policymaking. We're here at COP29, but I think it's really important. We were talking about opportunities for convergence, for coherence. And I think it's important to know that only 3 weeks ago, we were at the biodiversity conference of the parties as well. And within this conference of the parties, a new global plan of action on biodiversity and health was adopted. Sadly, we haven't heard much about this at COP19. Or COP29. Sorry, COP19. We should be hearing more about it. And what is the common thread? What is the common thread to bring this together? I think One Health is the way we can bring these different issue areas and the different global challenges together. And the Climate COP and the Biodiversity COP were both held within a month of each other this year, and they really can't be treated in isolation. Climate change drives biodiversity loss, but biodiversity loss in turn amplifies climate impacts, both having truly devastating health consequences. So addressing these crises in silos risks further unintended consequences, whereas integrated solutions offer opportunities for synergies that benefit ecosystems, communities, and economies alike. I think that it's fair to say that health must be at the center of both climate and biodiversity action, as it provides the most powerful rationale and motivation to address these interconnected planetary crises. The position paper that's being launched here today also aligns with this vision. It outlines 10 priority actions that exemplify how health, biodiversity, and resilience can be mutually reinforcing. From conserving biodiversity through sustainable food systems, to fostering mental health resilience, to reducing pollution and promoting innovative climate-smart solutions, such as climate-resilient healthcare systems, a circular economy, and, importantly, a Mediterranean research network. These actions represent the type of transformative approaches urgently needed in this region and beyond. And I think I will leave it there and very much look forward to hearing from all of the panelists joining us in presence and online. Thank you.
Thank you. Thank you very much, Christina. I will ask a round of applause to Christina because her work has been really, really inspiring. Thank you very much, Christina. Thank you. And actually, are these work that are needed to our researchers to continue to foster our action. And that's what we try to do with the International One Health Conference. The International One Health Conference was born 3 years ago with the commitment to gather academics, researchers, activists, in order to foster a common vision that was including the health of humans, the health of the ecosystem, and the health of animals. And every year, and we organize a conference. Now we have the third edition. Started in Catania, it's here the co-chair, Professor Margarita Ferrante. We then go to Barcelona, and this year to Greece to focus on Mediterranean. You said very clearly which are the content of this position paper that will be soon available on our website. Today we are launching that because it's important that, as we said last year in Barcelona, we need to bridge the gap between policies and implementation and science. And our position paper is made by two parts mainly. A background part that is defining the main scope, that is the Mediterranean, of course, which are the problems of the Mediterranean, like pollution, the Mediterranean diet, the society, and also what we want to focus, and I really invite you, when it's available on our website, to go and see that we make position, but also action points. For us, it was very important that in this position paper, we try also to bring to action. Okay? Science is, of course, studying, is, of course, analyzing, is, of course, producing paper, but need to foster the action. That's the importance that we need to stress, and we are stressing with the scientific committee of the International Health Conference since her birth. And with this, I want to also give the floor to the other colleagues that together with us. I will introduce myself. I'm Domenico Vito, and beside me, co-chair. I'm also part of a very strong and passionate research group that is the Metabolism Lab. We have today with us the director of the Metabolism Lab. But me, as other researchers, we are probably committed to bring science to policy and to action. I will give the floor now to some other of the actors that has led to this position paper. First of all, I will invite the other co-chair of the International Health Conference, Professor Margarita Ferrante of the University of Catania. Professor Margarita Ferrante, the floor is yours for your remarks. Thank you very much for being with us, and thank you for the passion and the commitment to make this journey together.
Thank you, Domenico. The passion is exchanged with us and with other components that are very enforced in the organization of our International One Health Conference. We have had 3 international conferences, one in Catania, one in Barcelona, and one in Athens, with the cooperation of many organizations. And all the topics are important are very strong for our fighting in One Health vision of the climate change effect on the health, and I'm very glad to be in this session in COP29, because the position paper are a great opportunity to share our work and to reach the support for to having One Health approach, the possibility to protect the health of the current and the future generation. So I take the floor to our other component of the International One Health, and I make many greetings to everyone, and thanks for your attention.
Thank you very much, Professor Ferrante. Thank you very much really for the effort and the commitment that all the research group has done properly to put in concrete the concept of One Health, and also to foster research on this topic. And every year in the One Health conference, we try to define some framework that is going to guide us into the definition of the scientific contents that are part of the One Health. We started with a four-domain framework, also comprising like the ecological domain, the social domain, the cultural domain, and so on. This year, the framework has been inspired by the Shanghai framework, also because the goal we want to achieve is to bring one end to the adaptation policy. Okay, so we have five domain, two for let's say substantial increase resilience of system, resilience of community, the health effects of climate change, environmental factors, and also substantially reduce, for example, vulnerability and so on. So that's one of our peculiar things. When we propose our scientific work for paper, we try to define some framework. But a very important framework in which we are developed is the framework of the SDGs. And on this, I will want to give the floor to Professor Gabriela Fernandez from the San Diego State University, who is also the director of the University Lab, that has made the localization of the SDGs with a really no one behind approach, a mission, a research mission. So, Dr. Fernandez, the floor is yours.
Hello, everyone. I'm Dr. Gabriela Fernandez, Director of the Metabolism of Cities Living Lab here at San Diego State University. We're located in Southern California. And within the past couple years, we've been advocating for the localization of the United Nations Sustainable Development Goals. We believe that in order for these countries and local governments to achieve them, it is important to have the storytelling of vulnerable communities. So for the past years, we've developed interactive dashboards, applications, in order to tell the storytelling of some of these groups that are currently being left behind. And as mentioned previously in the presentation that was given, it is important that in order to have the One Health approach, we have to create a balance between human, men, and nature. So in order for that to be possible, we need to be transparent and also understand what we can do with data. And so it is with technology that can really help us achieve these different storytelling and making sure that these different vulnerable groups are not being left behind. And so I want to thank Dr. Vito and everyone today for allowing us and giving us the opportunity to share the space of the One Health International Conference. We want to make sure that not only in the next year, where we have in Rome, Italy, we have more interdisciplinary backgrounds, let's say, tackle this aspect of One Health. So thank you very much again for your time.
Thank you very much, Dr. Fernandez, and thank you again for the commitment on this mission to foster research for the most vulnerable and for leaving no one behind. And probably to do not leave no one behind, but also to discover a type of knowledge that sometimes is underestimated, especially with an holistic One Health approach. And I now want to give the floor to a colleague that we are just coming out from a side event that was on this topic, also for the one that are following, and that is Mungo Argentan, a youth innovator, a passionate, say, custodian of the indigenous knowledge. And indigenous knowledge in medicine and health are essential, not only to revise and discover this holistic approach. I now give the floor to Gokul, and it's a pleasure to have you here with us.
Thank you so much, Dr. Vito, for giving this opportunity. Thank you so much for all the panelists today here. Thank you so much for listening to what we have to say from an indigenous perspective, like Ayurveda, traditional medicine, or indigenous medicine. So I've been in contact with Domenico from last 1 or 2 years. So we were trying to figure out how we can put this forward in the international space, and even we wrote a paper together as well. So it was a nice journey for me as well, for indigenous who are studying Ayurveda back in India. So for us, it's doing research or something related to that is not so much relevantly considered. which is like we are lacking behind something, because it's indigenous medicine. So like the framework is like not so much updated or taken into consideration too much places. So yeah, still thanks so much for supporting me doing all that stuff. So yeah, now we are working on how to preserve the information about how people are using plants and biodiversity. So I built an app. It's called Govardhan. It's like the world's first ever social media for plants, where we have like if you have a plant that's I'm a local person. I'm from an indigenous community. I know the indigenous name of the plant. So I have a plant. I use it for like maybe like tulsi, like an example. I use it for cough. So I know that how to use it. And it's an indigenous information. So if I'm having the app, I can like upload the information of that, take a picture of that plant, and the geo data of the plant will be uploaded within the app itself with the username that I can use it as a local name of the plant itself as a username. So as a social media, every plant will have a unique username. And I don't need to know the scientific name. I don't need to know a lot of information. I just need to upload the information so that I preserve my culture what I use, and I can share that with my colleagues, my friends, so that in my college space as well, I can like share that information and keep them up to date. So that was the main goal for me to make a small app which help my college students learn. But once I got to learn about COP, I went in like in COP26. I came to this bigger space where lot of countries coming here with like Cameroon and everything. I found out a lot of plants that I didn't know, which I'm an Ayurvedic student. I was like very curious and I wanted to learn, and I was looking for a global platform where I could find more like that. But it was like it's too complicated to navigate to understand is it true or false. So it's too complicated for me to understand. That's why I ended up with an idea of doing this. Now the app is available in Play Store, and yeah, still working on how the biopiracy kind of issues can happen. That's something I think WHO is also like looking forward to. So at the World Health Assembly, we made it over there, and also we did like a small side event on traditional medicine, Ayurveda, on like climate action, etc. over there, which was supported by the University of Geneva SDGs Solution Space. So they gave us a space after the Geneva Health Forum itself. So it was like really helpful and to learn how the international community is doing and reflecting that back to my community where students or people like who doesn't have that lot of hope that our medicine can be developed further. So it brought a lot of hope for everyone back in my community as well. And still like we are expanding to different domains like climate action because we want to use the app to bring awareness for the youth, how they can like people should value the nature, the biodiversity, not directly going to a pharmaceutical pharmacy and asking for a doctor for medicine. When we bring the awareness to the biodiversity to the youth, they will understand the nature's importance and try to help or preserve that or plant a tree, something like that, and also towards the climate change aspects and also traditional conservation. So that's my thing. That's what I'm doing. Thank you so much for giving this space.
Thank you. That's
Thank you very much, Gokul. And thank you also giving the chance to remind another important event that the International One Health Conference community is going to have just after COP. We will have a special session that starts exploring One Health dimension, case studies and practice in the MedLife conference in Istanbul, Turkey, next 8-10 December. So, me and Dr. Ferrante and also all the authors that submitted the paper we will present at this conference. So let's continue to follow us on our website and on our channel because the community is still active and is doing things and Baku is going to also participate in this session. And so today is not just important because we are presenting the position paper of the International Health Conference, but because also is the Children's Days, the 20th of November. Okay. Our conference, especially this year, has focused on the child and maternal health and risks, especially in the Mediterranean. We are talking about migration, about different type of challenges that the women and children can face. And on this, I want to give the floor to Nathan to give an approach from the point of view of the planetary Earth also, which is very connected to the One Earth approach.
Thank you very much, Domenico. And it's an honor to be together sharing space with a lot of new friends and also old friends who are actively trying to transcend and traverse these disciplinary divides and boundaries, which Domenico, you just referenced on the planetary health realm. So just to extrapolate a bit on how our belief with the team that I'm working with is that child health is planetary health. Likewise, indigenous medicine by any other name, instinctive, original, ancestral knowledge, these are grounding mechanisms which I strongly believe can help us to ground ourselves and give credit where credit is due. That being that the knowledge that we as human beings are not separate from, we are not superior to our fellow creatures in the web of life. So in the academic realm, along with the policy and governance spaces, we run a risk of falling into a trap of becoming tribal or tribalized and saying that climate and health, planetary health, One Health, eco health, any of these are where we are going to exclusively direct our energies. But I believe that we are all onto something, and this is something that our ancestors and the indigenous people still know and practice. And I believe that we have a great opportunity looking at days like today, which is World Children's Day, which commemorates the signing of the Convention on the Rights of the Child. This is an opportunity for us to do a serious self-assessment of how far we need to go and how intentional we need to be about traversing these boundaries, such that we who recognize that human health and environment, by any name, are profoundly connected, and that it is up to us to ensure that we move together and look at the synergistic opportunities to engage with the policymakers who are actively at this stage degrading and destroying the potential for all children everywhere to live a healthy life. So bringing in the Convention on the Rights of the Child and referencing the recently recognized right to a healthy environment, I believe it is up to us as academics, as researchers, as policymakers, and ultimately as advocates to join together with children, youth, ancestors, or bearers of ancestral knowledge, that being indigenous people and herbalists, to raise awareness about how we are a part of nature and to do what I will say is a reference with this report being highlighted to the Mediterranean region, being an opportunity to look at synergistic frames like place-based planetary health or community-centered, child and community-centered One Health, because this is a way that through using tools like art, like technology, and ultimately meeting people where they're at so that all of us can recognize that we have active agency in being co-creators of this bright future, which ultimately we all aim through our work to be a part of the positive change. But I think grounding ourselves in recognition that we need to be intentional about ensuring that we don't fall into disciplinary divides and explicitly looking at maternal child health and indigenous knowledge as grounding mechanisms that whoever we are in whatever space, we need to think about the children and we need to think about the bearers of this instinctive indigenous knowledge that we're a part of nature and use that as a levelizing grounding mechanism to ensure that we don't fall into the trap of the modern world where we're divided. Thank you.
Thank you very much, Nathan, and thank you very much for bringing this perspective that, of course, is synergic with the One Health concept. And from planetary health, let's go to planet health, but also innovation. And on this, I'll give the floor to Jody Serrano-Pons, Dr. Jody Serrano-Pons, one of our partners from the edition of Barcelona. That is, I can say, a gift that we encounter because really is like a volcano of ideas. And so, Jody, I give the floor to you For your introduction, please. Let's stay into 5 minutes, please.
Thank you very much, everybody, and congratulations for the paper, position paper, and thank you for being our colleagues and on that roadmap. No, we define ourselves as entrepreneurs, as innovators, group of doctors, nurses, physicians, whatever. No, bioinformatics that want to contribute in the innovation in global health, One Health, planetary health. As Nathan has explained very well, these overlapping fields are very important. And basically, as the position paper states clearly, we want to contribute in the innovation to help in the vulnerable population, in the disaster risk collaboration, because obviously we know, and this is the elephant in the room, and we are not going to enter into politics, but we know that in Barcelona, we have the headquarters of the Union for the Mediterranean, a political union that is not working because many things, it's obvious because of the war, because of many things. Without entering into that, we need border collaboration between entrepreneurs. We need border collaboration between cities, a city in Italy, a city in Tunis, Alexandria, Barcelona, Tangier, Beirut. So all the Mediterranean must work together. The best way to work together is through municipalities, through entrepreneurs, and innovators can help into that. Antibiotic micro-resistance must be handled everywhere. No? And of course, also migration, it's a very important planetary health issue. No? Without a good determinant socials of health, we will not solve many of the problems. So I think that the One Health plus planetary health vision must have into account this social part, and all together from bottom up, we can work together. And this is how we want to accelerate with acceleration programs, with innovators working in both parts of the Mediterranean. Because just to summarize, we are a lab now in the world. In very few places, we have high, medium, and low-income countries all together under a region that in the past was totally united, but now it is not, and where the climate change is affecting more than our region. So we have a huge opportunity to have these innovation networks, and this is why we launched the first chapter in Barcelona, and we're very happy to share with you now, Domenico, Margherita, Gabriela, and Marta Giovanetti in Roma in 30th of September, a new chapter of your amazing conference, One Health, and also adding our chapter. And just to finish, all together from bottom up with business, ethical business, proactive business, we can do a lot. We don't have to wait for big level politicians to implement these measures. So congratulations for the position paper. And we want to reinforce all the points with a very important collaboration between innovators. And let's remember that we have to make a sustainable diet and tourism in our home, Mediterranean. Thank you very much.
Thank you very much, Jordi, and thank you very much for this synergy that we built up starting from the Barcelona conference. Now, the journey continues. Today we are presenting the third International One Health Conference position paper, but we are already planning to have the next. Okay? And the journey continues, and to close this session, I will give the floor to Dr. Marta Giovanetti from Campus Biomedico Roma. They will be the top for the next One Health, and One Health 2025. So Marta, please, the floor is yours. Let's, you can say, reach with the next conference.
Thank you so much, Domenico, and hi everyone. So first of all, congrats for the position paper. It looks absolutely great, and thank you actually also for giving us the chance to, lead the next conference which is supposed to be held by in our institution, which is the Campus Biomedico University. So I'm happy today actually to speak on behalf of the Dean of our faculty, Professor Marcella Trombetta. She she was not able to join us because of some institutional appointment. I just want to mention that myself, I am actually an assistant professor over there, and over the past 10 years, actually, I have been working in trying to develop, like a kind of novel approach for the study of infection diseases. And most of the time, I mean, like one of my main points, it was like try to understand how climate change might be able to, increase and enhance the transmission dynamics of novel pathogens into novel regions. So we are absolutely happy to have the chance actually to host the third edition of the One Health conference. It's going to happen next year, and actually in October, and that's supposed to be also a very special year, right? Because of the Jubilee. And because of this, actually, as Domenico said, during all the different editions, actually, we were focusing on some specific framework or keywords. So for the next one, we decided to select the integral ecology or human ecology, also to try to make a kind of link with the concept proposed by the Francis encyclical Laudato Si, which advocate to the use and implementation a kind of holistic approach in order to try to bring together the human, the animal, as well as the environmental health. So we truly think that by integrating this kind of ecological perspective, both from the, like the human and the animal one, this kind of conference might be able to try to address the one that's supposed to be the global challenges, such as, for example, the emergence of novel pathogens with a kind of endemic potential, the importance of climate change and how climate change might be able to drive the transmission dynamics of novel pathogens into novel regions, and also biodiversity loss. So let's say this kind of concept really emphasize the importance to try to bring together and establish a kind of sustainable practice that might respect this kind of balance of natural system with the aim to try to create a healthier planet for the future generation. Thank you.
Thank you. Thank you very much, Marta, and such a pleasure to be hosted in Rome next year in October, from 1st to 3 October. So let's keep updated on our website. We will inform about all the program and also the this activity that you're gonna run. And so I'm gonna close now the session. It's been really an important session because we kicked off something that in the next days, today, these days, this week is the high level segment of COP. We are gonna address decision maker properly to insist on the topic that nature, environment, and animal health are connected, not detached. And so today was the first step, such a big step. Thank you very much for everyone for like the work that we spend, also the commitment that was spent today. And congratulations to all. Thank you very much.
Thank you.